Hello, good afternoon, good evening, everybody. Happy Sunday. It is March 17th. We're talking about dental implants because something happened to me yesterday while I was working and someone asked me a question. And I thought that this would be very appropriate for the general audience to know what happens if you don't do anything. Because he came to me, and I'll tell you the story in a second. But I'm going to go live right now on Instagram because, like I said before, on Instagram, for some reason, we have to go to Instagram and then we have to click on go live now. Everything else from X to LinkedIn to Facebook to every other platform, it's automatic except for Instagram. You have to do some legwork. All right, enough complaining. So, dental implants. Before I keep going, I know that you really want to know what's going on with this patient that asked me the question. I'll tell you in a second. But today is episode number 59, which means that tomorrow's episode 60, which means that I'm going to come up with something different for the next 30 days because obviously in every 30 days I'm trying to improve something so that I can provide a little bit more value to you, and that's so that we can be more coherent and congruent in what you want, what I can deliver. So again, today we're talking about implants, and let's get us started because time is of the essence. So dental implants, as my face covers it. Let me see if I can move my face. Can I move my face? No, I can't. Okay, as this the title says right there, right behind my face, says what happens if I don't get it. Now there's a story behind that, and the story is very simple. So a patient came in emergency. He came in and he wanted me to take out his tooth because a previous dentist saw him, and he thought that he had a cavity. So I took an X-ray, examined his tooth, and I saw that there was no cavity. So I let him know that the reason why he's got all these problems because he's got periodontal disease. Periodontal disease means that he's got a lot of bacteria and gunk and stuff like that in his gums and his bones. He's lost a lot of bone, and now he's suffering with the same kind of pain that you would suffer if you were to have a cavity. But I also showed him that once I flicked off some of that calculus, hygienist, if you're watching this, you probably would love this if you actually saw it in his mouth. But anyway, I was taking away the stuff and I was showing it to him, and I gave him an ultimatum. I said, look, if you extract your tooth is gone forever. But if you keep your tooth and you go to a periodontist to assess the rest of your teeth to see whether or not your teeth can actually be kept in your jaw, then you have a very favorable chance if you can keep your teeth in your jaw. A very, very favorable chance for you to keep your teeth. But if you extract your teeth, this is what this is what this podcast is about. This podcast / webinar. So check this out. I know I pause for intensity. So this is what happens. So as you can see here, it says 30%. Okay, and it says 30%, and there's an explanation right beside it on the slide. It says bone loss after extraction. So you have 30% of bone turnover. So as soon as the tooth is extracted from the socket, from the bone, you have 30%, 1/3. Okay, so 1/3. So if you were to take your finger, see how your finger is split into three, you basically lose the top part of your finger. Okay, so automatically you start losing a ton of bone. That's something to really take in because you're like, all right, well, I'm going to be extracting my tooth. Is anything going to happen? Yes. And the thing is that the bone doesn't just decrease from height wise, like from vertical, it also decreases horizontally or width wise. So it decreases in all three dimensions. So you have 30% loss. And I'm going to show you, and I'm going to warn you right now because the next picture, I should remove this so I can talk to you and address you. But the next picture I'm about to show you is not graphic because there's no blood or anything like that, but it's of a tissue of bone that has lost quite a bit of bone because the person decided to extract their teeth. Okay, and you're going to see the difference between when someone has their teeth in the same picture and when someone doesn't have their teeth, what happens. Okay, hope you're ready for this. So remember I said 30% loss. And also there are studies that show that 2/3 of your bone and your tissue get lost within 3 months of you extracting the tooth. You lose around 2/3 of your bone and tissue within 3 months of extracting your tooth if nothing is done. In other words, you don't have bone preservation or you don't have an extraction. You don't have an implant. So if you don't have an implant, then you're going to be susceptible to losing up to 2/3 of your bone and tissue within the first 3 months of extraction. Now check this out. Look at this. This is an example of, this is bone, by the way. I'm about to show you the next picture because the next picture actually shows you the complete thing. This is just a zoom in portion. But this is a picture of a jaw. Yes, there were teeth there at once. Now check this out. Watch, you ready? Look. This is how, now you can see where the arrows are pointing. The arrows are pointing where the bone has resorbed. They've lost bone. Literally, they were not born like this, by the way. And when people look at old people, they're like, oh, they were probably born like that. No, old people don't just become, they're not born old, right? Same thing with this bone. This bone wasn't born like that. It was born with teeth in it. When they had teeth, you can see where the teeth are in the front. You can see there's quite a bit of bone. Now you can see where the teeth aren't there anymore. You can see how much bone is lost. Now, I can't emphasize to you how much this is important because when you lose teeth, you actually lose a ton of bone. I'm going to put it on for you. Just see again the difference between someone that has the exact same jaw, by the way, where there's teeth, where there's a lot of bone, a lot of tissue, everything looks healthy, and then where there aren't teeth. Now, let me tell you something. You can't grow that bone back. You can't. There's no such thing as growing bone back. When you cut your hair, you're like, oh yeah, I cut my hair, or the barber screwed up, or the hair salonist, if that's their name, cut my hair. You cry a little bit, but then the hair grows back. That doesn't happen with the bone. All right. So I hope you got the point that as soon as you extract your tooth, bone's gone forever for your life. Now, this next one, by the way, I should put a disclaimer. This next one is a little bit graphic, a little bit. Okay, so if you're squeamish and you don't like to see bone and blood and stuff like that, then I guess just like turn away. Don't look at that. Okay. All right. So check it out. This is called a graft. So this is what a graft looks like. So when you extract your tooth and your tooth suddenly looks like, or your bone suddenly looks like this, and you're like, oh, okay, I can't chew very much. My entire face looks different now. My face looks different. My face looks nice and short. Not nice, but it looks short. And I'm looking really old, but I'm only in my 30s. And I'm losing a lot of these teeth. I can't lose any more teeth. I need to preserve what I got. I want to put implants in. So if you say that, but after you've lost all your bone, now this is what you have to go through. You have to go through something called grafting. Okay, bone grafting and tissue grafting. So there's a lot of grafting, which means now the implant procedure actually becomes more complicated and it becomes a lot longer. But it's something you have to do if you have lost your bone. Now, does that mean that you're building back up? Does your bone get built back up to how it was originally? Heck no. Of course not. Does it come close? Maybe, depending on your luck. But why would you take that chance? So that's my thing. When the patient came in and he asked me that question, he says, what happens? He goes, oh yeah, like I've lost teeth. I'll just put a denture, a note for if you're thinking about putting a denture. I'm telling you right now, people that have dentures, their quality of life decreases so significantly. Everything changes in their life to the negative. Everything. They can't chew properly. Steak, forget about it. If you like steak, forget about it. If you like any kind of meat, forget about it. Okay, because it requires chewing motion. With dentures, you can't really chew well unless you have implants supporting the denture. Again, so now you're talking about a much, much, much more complicated procedure that costs much, much, much more than just replacing your teeth with implants. Okay, so keep that in mind if you're thinking about whether or not you should put something in there. Never delay it. As soon as you can, do it. Now, do you have to put, and by the way, this here is what an implant, I have an example of an implant. You can see it kind of, I don't know if you can see it, but it's right here. If I lean forward, can zoom in. There we go. So this is an implant. This here, that's an implant. Okay, so you can see it's nice and small. And if I were to take Dexter here, okay, and you can see it right here. So I'm going to put it right there. Okay, you can see it right here. So you can see how the implant looks compared to the jaw. So it's kind of almost the same size as the root, right? So, but this is the implant. It's not very scary. It's not scary at all. Okay, and the procedure, if it's done very soon after the extraction, it's pretty straightforward. Okay, you don't have to go through all this bone grafting stuff. Okay, so this is bone grafting, and this is more grafting. Okay, I just wanted to show you more grafting. And this here is what happens as well. So not only are you going to lose bone and you're going to lose tissue, your teeth are also going to shift. People, please try to understand me. There's a lot of changes that happens. People think that when you go to the dentist and the dentist is giving you advice and whatever, you guys, not you guys, but like some people think that we're giving advice based on what's going to feed our pocket, in terms of money. You're like, oh no, this person just wants to make money. No, we don't. Obviously, I'm giving this to you free, right? This is free knowledge, but I'm giving you examples. I'm showing you example of what's going to happen. Is it scary? Of course it's scary. So that's why you should, do your best to not let this happen. I went to a dermatologist, and the dermatologist, she said to me, she goes, people don't put on sunscreen, but if they knew what I knew as a dermatologist, they would never leave the house without sunscreen, without a wide brim hat, without covering everything if they knew what I knew about the sun and the damages that could occur with the skin. So same thing with me being in the profession, having seen what I've seen the past 9.5 years. Yes, it's been that long. Of putting implants in, of seeing people lose their teeth, of seeing what happens with the teeth shifting, with teeth grind. I've seen it. I've seen a lot of it. And so when your dentist tells you all this stuff, believe your dentist. Okay, because you can easily just Google it. You can see what happens when you lose your teeth. I mean, look at the pictures. So what happens after? So now you lost your bone, you lost your tissue. You're also going to get your teeth are going to start to shift. Okay, it's going to start to shift, and then you're going to start to have these spaces. Okay, you're going to have these spaces between your teeth, which means more plaque is going to be trapped, which means now you have a higher chance of getting something called periodontitis, which, by the way, it's like diabetes. Once you get it, you get it. Periodontitis. It's different than just gum disease. It's gum and bone disease. Okay, once you get it, you get it. You get it for life. And now you have to maintain it, because if you don't maintain it, you allow the bacteria to fester. Then you start losing bone even more. Periodontitis becomes much worse, and you start losing teeth. Okay, that's the natural progression of periodontitis. So stop from getting it from the get-go. And this, by the way, when you start actually like extracting your teeth, you're actually lending yourself to periodontitis. You're actually going in that direction, because you're going to start losing bone. You start losing bone. That's like an automatic introduction into periodontitis. No one really talks about that part, but it is. And you're going to start exposing your root, which means more sensitivity. Like I said before, more plaque trap around your teeth. And now check this out in the next picture. Now you're going to have something called spaces, as I mentioned, and eruption. You're going to have eruption of the tooth, whether it's the tooth on the bottom or the tooth on the top, depending on where the tooth on the opposing arch is missing. You're going to have that tooth descend into that space or ascend into that space. Now you're going to have a bite that looks, or where am I pointing? I'm pointing this way, right? Now you're going to have a bite. Yeah. Does that look good in the picture? Anyway, now you're going to have a bite that is completely messed up, and your teeth are going to be they're going to start to fracture. Okay. So why put yourself through all that? Now, what happens if your teeth, you start biting like that, and obviously your bite's not going to be normal. You're going to be biting more on the other side than that one. And then, as a matter of fact, what happens is that now you have a higher chance of getting cavities on the side that you're chewing more on. Like it's actually a destructive process. Extracting teeth is very destructive. So whatever you can do to preserve your teeth, preserve them as much as possible. And whenever you can put an implant, and here's the thing that probably most of you don't know. If you have a missing tooth and you're like, I can't afford an implant because it's too expensive. Well, what I would recommend you do is at least get this portion, this part, the actual titanium part of the entire implant, this part. At least get this part put into your jaw to at least preserve the bone, so you don't lose more bone, you don't lose tissue, because your bone's not going to go away as long as it has something to grip onto. So at least do that part. And then when you can save enough money for you to actually, put a crown on. So what I would do if I were you and I couldn't afford a full implant, I would get this part put into my jaw, and I would get a night guard. Okay. And that would help my teeth from staying in the same position as they are. So it helps from my teeth from descending, and it helps my teeth from shifting. So that's what I'd get. I'd get a night guard, and I'd put an implant in, and then save more money. And then you can put a crown in. There's your solution to the problem of I can't afford it, or go to a dentist, such as Spinati Dentistry, that offers payment plans. Either way, don't wait. Do not delay. Okay, now, what happens with all this stuff is you experience something called pain. That's right. Start getting pain. And with pain, obviously, no one likes pain because you start losing sleep and your work gets affected, and you start have to take time off from work, and that means more income loss, and which means more. This is actually costing you money because you can't work and you can't provide for your family because of this pain. And this pain is happening because you're losing your tooth, and you lost your tooth because you didn't want to replace it because you said you couldn't afford it. But I'm telling you, as I tell everybody, you cannot afford not to have an implant because the consequences are astronomically more expensive than for you to put an implant inside your jaw. That's all. Okay. Now, this is quickly the anatomy of, or the structure of the dental implant. You have three parts. That part there that I was showing you on the screen with the skull, that's the titanium part, and then the crown part gets put on there after. And that's it, ladies and gentlemen. That is it. That is all. Thank you so much for your time. It's 60 minutes of pleasure of me educating you on dental implants. If you have any questions, make sure you ask them anywhere in the comment section, and I'll make sure to respond to them. Have yourself a great Sunday. And yes, it is St. Paddy's Day. Happy St. Paddy's Day. Behave yourselves. Be good. Be well. And as always, keep smiling. Good night.